Hey guys, Dr. Mark Dailey here. I wanted to take a minute and, in the most simple terms possible, I want to explain what's happening in a peripheral neuropathy patient. So, your body has tiny wires, and those wires are called nerves. These nerves carry messages from your brain to the rest of your body and back, like text messages or phone calls. Peripheral neuropathy means that some of these nerves are getting damaged and can't send messages the right way. So, how does it happen, or what is the mechanism of action? Normally, these nerves are wrapped in a protective coating called myelin. It's a lot like plastic around a power cord or an electrical wire. The damage starts with things like diabetes, alcohol, chemotherapy, injuries, poor blood flow, or even toxins can hurt the nerves or that protective coating known as myelin. What happens is some of the signals don't get through, causing numbness. Some signals get static or too strong, and they cause burning, tingling, or pain. Sometimes the nerves forget how to work the muscles, causing weakness or trouble walking. And it is a progressive condition that gets worse over time. In the early stages, your feet or your hands may feel tingly or like they've fallen asleep. The middle stage, we see a lot of numbness, burning, or sharp pain start happening more frequently. The latter stages, the numbness spreads up the legs or arms, balance gets harder, and muscles can weaken. So you can think about it like a Christmas tree. At first, one or two bulbs flicker. This is like tingling. Then more of those bulbs go out. That's like numbness. And finally, a whole section stops working, and that's weakness or loss of feeling. So this is just a really basic overview of how that happens. So hopefully that gives you a little bit of insight. Now, what we're doing here is we are using the class 4 robotic laser, which literally penetrates through the skin. It does several things, but what we're looking at here with neuropathy, it reduces inflammation, which right away turns down the pain pattern. It also increases blood flow, which is important because we want to get nutrients to the area. So your feet, for instance. And then the most exciting thing it does is it literally excites every cell it penetrates and causes that cell to produce something called ATP. And ATP is one of the very basic building blocks to restore that myelin covering. Now, if you're taking Lyrica or gabapentin or Neurontin, those simply block your brain's ability to perceive the problem while the problem gets worse. So if you're suffering from peripheral neuropathy, it's important that you get on top of this. And if I can be of any help, feel free to reach out to us, either call our clinic or if there's a clickable link here, click on that, and I'd be happy to help and evaluate your case. Thanks so much. Have a great day.